Yeah. Okay. Hello, everyone. This is Dr. Gurjeet from Dynamic Health System. So let's start today's live session. It is going to be a really interesting session and really informative too. So just be conscious and try to be concentrated and grab as much as information you can. Okay. So first of all, welcome to our academy, Dynamic Health Staff Private Limited. We are one of the biggest recruitment companion for healthcare people specifically. We help in both IELTS and OET. Today we will just talk about occupational English test. Okay, there are different steps of today's lecture. First of all, what is OET? Then who recognizes OET? Then why to choose OET? And then how to attempt OET. Okay, that is the most important thing. So, without wasting any time, let's just start. Uh, First of all, OET. What this OET is? Occupational English Test. It is one of the English proficiency exams that is conducted by CBLA, that is Cambridge Boxer Language Assessment Trust, which is associated with the basic goal of OET is to understand how a particular candidate, any particular health professional, will adjust in an English-speaking hospital environment. Once you reach there, once you reach an English-speaking nation, how you will cope up with the environment. That is the basic goal of occupational English test. Okay, they are not assessing your medical knowledge. They are not assessing how much knowledge you are having about your profession. They are just assessing uh, your English proficiency, how well you are acting in an English proficiency language. Okay. Coming to the next thing, first of all, sorry. So now, what are the professions which include OET? There are 12 professions, obviously, those professions which are having their basis as a medical medical field or healthcare environment. Those professions include OET, dancing, speech pathology, podiatry, occupational therapy, dietetics, optometry, radiography, pharmacy, physiotherapy, and veterinary sciences. So these are the different 12 professions in which OET is acceptable. Uh, any person who is having a graduation, okay, minimum graduation in these professions is capable of giving OETs. These are the countries which accepts OETs as a minimum requirement for their work visas. UK, Ukraine, Namibia, USA, Australia, Ireland, New Zealand, Malta, Dubai, Singapore, and so on. Okay, these all recognizes OET. Now coming to the format, there are four basic modules. Okay, modules, I will say that your exam will be divided into four parts: listening, reading, writing, and speaking. So these four are the basic important things which we have to keep in mind, because these all are responsible for communication also. Whenever we communicate with any person, these all four are basic skills that are required. Coming to the grading. Now, your grading, how will you will be assessed? Okay, that is the another important question. There you will be graded from A to E. A being the highest grade and E being the lowest grade, which obviously will be emphasized on the numerical scores you are getting. If you are getting more than 450, you will be getting A. From 350 to 440, you will be getting B, and 300 to 340 C plus. This is the least requirement here that you require to get entry to any country. Okay, so C plus is the basic thing which is required. Below that, C, D, and E, they are not acceptable anywhere. So we won't be focusing on that. First of all, let's just talk about A. If a particular candidate can get numerical scores from 450 to 500, that particular candidate will be getting A grade easy. Now, what you require to get A? What is the things? The basic requirement for A is that communication. a candidate should be able to communicate very fluently and effectively. Okay, with patients as well as health professionals. Even they can understand all the documentation, all the clinical context very easily without any hesitations, without any grammatical inaccuracies. That particular candidate will be getting A. Coming to B, B grade is given to the candidates who can communicate effectively with the patient. Okay, with appropriate and registered on and that's okay. With occasion, some of the accuracies are acceptable, but again occasional. This word is really important, guys. Occasional inaccuracies are acceptable. Occasional means it should not be frequent. Okay, it should only be occasional sometimes. But you should not be, doing any, a big grammatical mistake. That should not be done. Okay. Coming to C plus, more than 300 until 340, that particular candidate will be getting C plus. That means you can maintain infection in a relevant healthcare. But occasional errors and lapses are there, hesitations are there, pauses are there, but again, occasional, not frequent. Okay, so that particular candidate will be getting C or C plus. Now, this is the basic requirement that is required to have a good communication, good, score in OET. Uh, Now, who accepts OET? Okay, as I told you at the starting that Australia, New Zealand, and so there are different countries which accept OET, but they have a set of standards, set of scores that you must attain to get entry there. First of all, if you talk about Australia, Australia requires at least A or B in all the modules. Okay, that means at least B in all the modules. Okay, in all the professions, in all the papers, you require at least B grade in Australia. Okay, so that is big requirement that you can get with proper practice, proper strategy. Coming to New Zealand. For New Zealand, the scores are set by a Nursing Council of New Zealand. Okay, again, you require minimum 350, that is B grade. Okay, so B is a key here. Okay, you have to get B in all the modules despite this is listening, reading, writing, or speaking. Okay, any of the module you must get B. Coming to Ireland. Now, in Ireland, the things are a bit easy. Okay, I will say a bit easy, not really. Okay, the Nursing and Midwifery Board of Ireland, that is NBI. Okay, they have set OET requirement for the nurses and midwives to register and work at triple B and C plus. Now, triple B, C plus, these are not specific. For example, you can get C plus in any of the module. Okay, if you are getting C plus in listening, that's okay. But at the same time, you must get B in reading, speaking, and writing. Okay, same goes if you are getting C plus in reading. Same goes if you are getting C plus in speaking and writing, respectively. 1 C plus and 3B are required minimum. In UK, again, Nursing and Midwifery Council, NMC, okay, you require at least B grade in all the 4 subsets, okay, at least C plus in writing, okay. C plus is the minimum grade for writing. It is only specific to writing, guys, okay. No other module can be accepted below B. So these are the basic requirements for all the modules that you must get to get an acceptance there. I guess I have been clear until now. Uh, Now, why? What is the need? Okay, there are many students who are really, really confused that they should take OET or not, because I know it is a bit of expensive test. But why? What is the need? There are 4 different points why we should choose OET being an healthcare professional. I am from medical background, so I know that OET will be a little bit positive. It will be a little bit advantageous for us if we choose OET as our English proficiency test. The first thing is it will be meeting language requirements for both registration as well as immigrations. Okay, how? First of all, OET is an English proficiency test, right, guys? So it will be accepted in UK by NMC, okay, General Medical Council (GMC), by various royal colleges, okay. It's acceptable anywhere. You can get an admission anywhere if you have OET. Apart from that, once you are going for your immigration purposes, okay, for your tier 2 visas, okay, if you already have OET as your requirement, there's no need to give any other English test. Okay, it will save your time, it will save your money, it will save you from hassle. Okay, so it will be a important point that OET language meets the requirement for both registration and immigration. Coming to the second point, that it is the only test that is specific to the healthcare. Again, we have a lot of English language tests. Okay, there's IELTS, there's TOEFL, there's Duolingo, okay, and so on. PT is there, but of those, one particular test is there which is just specific to healthcare people, that is OET. Okay, it has been designed specifically to meet the communication needs of an English speaking healthcare workplace. At start, I told you that the basic goal of OET is to understand how a particular candidate will adjust in an English speaking environment. So that is the reason why OET is a bit of you know dissimilar from others. Okay, it is unique from others. Okay, because it is specific to the healthcare environment. Okay, and these are, the test materials are developed in, consultation with the subject matter experts, which they applicate the English language skills in a healthcare setting. So it will be really easy for you to, have a bit of concentration in this one, because you already will know a lot of things in this particular test. Coming to the third point, that healthcare professionals feel more confident talking about it. Now, this is the most common thing, guys. In my 5 years of experience, I have met a number of candidates who come after OET, and they say, sir, that this was just another day at work. Okay, that is the most familiar task. Okay, because you will be having more confidence, because you already have gone through those particular things. We will talk about the modules when we will be talking about modules in the coming slides. You guys will automatically know that why I'm saying this. Okay, so because the test contexts are familiar, they are covering the task and vocabulary that they can encounter in the healthcare workplace. Okay, easily. Coming to the next thing, okay, it sets candidates up for the success at work. Okay, how? Because whenever we go to any new country, new workplace, we usually have a bit of curiousness how we can adjust. That particular thing is there. But here, OET exam format is such that it will be designed to assess general skills, that whether a particular candidate can be fitness for academic study or not. Okay, it will directly help you to understand that are you fit for the role, are you fit for the work. Okay, there's no other English test which is available in UK to do so. Okay, so it is just the replica of your healthcare environment, so you guys already will be having a lot of things that you have to do once you reach UK. Okay, so these are the four different points and four very important points which will help you to understand why you must take OET as a main proficiency test. Coming to the next thing, now let's talk about format. How to crack OET? What are the things that we require? For that, we will divide our module learning into two things. First step, we will understand the format. Second step, we will understand the tips. Okay, so these are the four things on which we will be focusing. Coming to part A, consultation extract. Now, consultation extracts, these are the extracts in which we have to have the ability to identify specific information during the consultation. Okay, we must specify, we must identify a particular information. For example, the format of part A will always be, will be a consultation extract. That means a particular patient is there and he's with the healthcare professional to have a conversation. Okay, you will be listening to recorded health professional patient consultations. Okay, it will be there, and you will be asked to complete the health professional notes. Okay, so that is the thing which is there. Okay, consultation extracts. It will be a normal conversation. All the questions will be sentence completion questions. Okay, now one thing which you have to keep in mind that uh, these consultation extracts, the health professional can be from any of the 12 professions. Okay. The question paper will be similar to all the 12 professions for listening. Okay. That thing you have to keep in mind. Part two will be a short workplace extract. It can be anything. It can be team briefing, handover. It can be health professional patient dialogue. Okay. Here you have to answer one multiple choice question. Okay. For one extract, for one audio clip, there will be one multiple choice question. Okay, so three options will be there for that. You have to understand the question and analyze all the three options and answer out. Coming to part C, it will be a presentation extract. Okay, now you guys must have been, indulged. You must have been part of the health talks. Okay, during your colleges as well as your workplace. That is for sure. So those health talk will be the topic main central topic over here. There will be a presentation related to a single healthcare topic. Okay. For that, you will be asked to answer 6 multiple choice questions. There will be 2 extracts. Altogether, there will be 24 questions in part A, 6 questions in part B, that is 30 questions, and 12 questions in part C, that is 42 questions. So this all is the listening format. You will be getting a question paper, you will be provided with the headphones, and then you have to answer out questions by listening the audio clip in your head. So how to attempt that? The basic thing, there's what are the tips to understand the sentence completion questions in part A and multiple choice questions in part B and C. Let's come to that. Uh, Tips to part A. Let's go part by part. As I explained that you will be having 2 different extracts. Okay, there will be a nurse. Okay, let's assume the health professional is a nurse. Okay, it will be a nurse and patient talking. Okay, some of the things which you have to keep in mind that most of the time in the consultation extract, it will be the patient who will be talking. Okay, health professional will just ask the questions most of the time, just like it happens in our real life scenario. Another important thing which you have to keep in mind that you are required to fill the gaps, fill the sentence complete. Okay, these are sentence completion questions like filling the blank questions. So you have to fill up those blanks by, understanding what the patient is saying. Whatever you are writing in the gap, it should be, same. Okay, do not change, do not rephrase, do not use synonyms. Okay, do not translate, because if you did, even if the meaning is same, you will lose your marks. Okay, there is no word limit. You can write it according to the things which you are hearing. It can be number, it can be word, it can be 2 words, it can be both also. It can be both words as well as numbers. Okay, so you must have your listening skills ready, and you must have a bit of thing in your mind. Okay, that what that person is speaking. Now, how to understand these things? Reading time. You will be provided with 30-second waiting time before the start of each extract. During that, you have to mark your keywords. You have to go through all the 12 questions, and you have to understand what they have asked. Okay, so self-prediction is necessary here. If you do self-prediction in a proper way, you can easily get a really good score. Okay, so that is the first thing. Uh, Coming to the next thing, let's just understand part A sample. Let's just assume patient says something like this. Well, nurse, I haven't been feeling well too lately. And in particular, I'm finding the evenings pretty dreadful. For about 1 week now, I have been experiencing faint evenings. Okay, so let's assume this whole was a script. Okay, this is the thing which was said by the patient. Now let's just understand, let's just assume that these are the case notes. Felt blank, especially in the evening. Now I'm giving you 1 minute. Just have a look at this one and try to uh, find out the answer.
Good evening, all. I'm Jerry. I'm one of the OET and IELTS trainers of the
Highlighted in bold. Okay, like patient, reason for refer, background, occupational, treatment history, because these words will, make a course of you. Okay, it will make a course in front of you that what the speaker is going to talk about. Okay, so these words are usually uttered by health professionals. So remember that this particular thing. Okay, for example, word occupational. Okay, for the word in occupation, work can be used. Okay, so these things are there. Okay, so that is how we have to attempt our this thing, part A. Coming to part B. Now, that was part A. I hope that I have been clear with that. Now in part B, as I told you, there are 6 multiple choice questions. For each question, you'll be getting different case note, different audio clip. For example, this is the question. You hear a nurse briefing her co-worker about the patient. What does he want his co-worker about? And there are 3 options. Okay. Now, what you have to notice, okay, there are 2 parts of the questions. Okay. First part is you hear a nurse briefing her co-worker about the patient. So this just tells us you about what you are going to hear about. Okay. It will be known as context shape. Okay, that you will be hearing which of the health professional talking. Okay, it can be a ward boy, it can be a senior doctor, it can be a trainee doctor, it can be anyone. They will just give you one just before. And then second thing, what does he want about? This is the main question. Okay, what does he want about his co-worker about? Okay, so what is the thing which we will be focusing on? Okay, so these 2 parts will give you a clear idea that there are 2 speakers. Okay, from the second you can identify that at least one speaker is me. Okay. So this is the way you will be asked the answers in part B. Now there are different types of questions in part B, just like detail identification type, just like this. Okay. They are fine asking about one particular detail. Okay. You have to identify what is the detail of this extract. Okay. Then second is opinion-based questions. Opinion-based question, these in this you are asked to identify someone's opinion about a certain thing. Okay. That what is the opinion of this thing? Okay. What does the speaker wanted to say? Okay. Or here we can say that what a co-worker had an opinion about. These are second type of question. Third is straightforward. Okay. They will just straightforward ask that what why does A do B? Okay, why does nurse did this particular thing? Okay, simply these type of questions will be there in uh, part B. Okay, so you have to understand all the three options. You have to understand all the uh, all the options which are required for your part B. Okay, and then you have to analyze the three options and find out the correct. Simple. Uh, Here we have one positive thing, that as I told you that there are separate audio clips and there are separate questions, so it becomes a bit easy for us. As part C is concerned, okay, as I told you about part C, uh, now in part C, what you have to remember that part C is one of the most challenging things. Reason being the extract lasts for about 4 to 5 minutes. Okay, and also there will be 6 multiple choice questions. So it's up to us how we have to understand that the right speaker is talking about question number 31st now, then 32nd, then third. So this becomes a bit difficult, but not too much difficult. Okay, with the proper strategies, we can easily get it. Okay, now for example, let's assume this is the listening part C sample. John showed a little enthusiasm for receiving treatment. Some co-workers in the clinic took the view that he refused to help himself. There was a little they could do. It was right, they said, but I do not agree, since John could not use his legs or right arm. I made sure we concentrated on what he could do with his left hand. For instance, I worked on strategies to help him dress. We worked on skills like making him write his left hand. I wanted to ensure that I could be at least get him to function by whatever means that were open to him. Now, this was a script. Okay. Now, let's assume the question is, because John seems uninterested in the treatment, Hannah decided to concentrate on what he could achieve easily, allow him to try and help himself, making him come to his terms with his injury issues. So I'm giving you 1 minute again, a bit of time. Just go through the script and try to guess one answer from these three options. I guess you guys have guessed right. So let's just discuss. Uh, how to attempt. First of all, let's just understand how to attempt these questions. Okay. Uh, First of all, remember that you will notice the first and second options are different from part C. That is the first thing. Then the first two options concentrate on what John can do, while the third option focuses on his recovery process. So if you can note down what he could do, allow him to try and help himself out. Okay, so it is giving them a sense of independently. Okay, so that is the first thing. So that's why the keywords for the first and second option can be easily himself. So if we simplify these options, they can be put like this, like easy improvements, motivations to act independently, helping John to accept his injury issues. So if we take into account the audio, there's no mention. They are not mentioning that they are encouraging the independence or working with the joint to accept his injuries. Okay. So obviously, second option is correct because we have to ask them to, act independent. So that is how we have to do the listening part uh, C. I guess I'm clear until now, right? Now let's talk about the next module, obviously the reading module. Okay. Now in OET reading, let's first of all just talk about the format. There are three parts again, just like in listening, there were 42 questions. Here also there are 42 questions. Listening was also non-profession specific. This is also non-profession specific. That means every profession, no matter from which profession you are, you will be getting the same question paper. Now, listening is divided into three parts again. 42 questions are there. But mainly it is divided into two parts. Part A is expeditious reading task, and part B and C altogether are careful reading task. Now, expeditious reading task means, as the name suggests, you have to be quick. Okay, you have to expedite your reading by solving 20 questions in 15 minutes on. Okay, that is the basic thing. Now in part A, there will be 20 questions. We have to solve them all in 15 minutes. That is one of the big tasks because we have to manage our time. So our first approach should always be time management. Okay, we have to learn how to manage our time and finish these 15 questions, 20 questions in 10 to 12 minutes itself. Okay, and that you can easily attain with a bit of strategy learning and practice. Now, what is these questions will all about? These all will be related to the four texts. Okay, there will be four short texts which will be related to a single healthcare topic. For example, let's just assume diabetes. Okay, the first text will be related to diabetes. Second can be type of diabetes. Third can be symptoms of diabetes. Fourth can be diagnosis of and treatment. Okay, anything you can think. And there will be 20 questions which will consist of first 7 questions as a matching, next 7 question as a sentence completion, and the last 8 questions, 6 questions will be short answer questions. So you have to understand how to approach all these three differently. So coming to the part B and C, after 15 minutes, you have to cover part B and C altogether in 45 minutes. First part B will be, it will be 6 short texts, and for each text, there will be 1 multiple choice question with 3 options. The context will be policy document, hospital guideline, manuals, or internal communication, can be any of these, such as emails and manual. Okay, and you have to solve 1 multiple choice question with 3 options. Coming to part C, it will assess your ability to identify the detailed meaning. It will be, these will again will be, 2 long texts will be related to healthcare, single healthcare topic. The text's length will be around 800 words each. Okay, for each text you must answer at least 8 questions. Okay, these will be having 4 options again. Okay, so that will be your format for part A, B, and C. Now let's just understand how to. What are the strategies and all. First of all, let's just understand about reading part A. Always make sure that you read a little title of the text. That is really important. Okay, because if we are reading a title, we we usually get a lot of understanding from that. Okay, title prepares your mind for what you have to work on, because there are certain words in title that are relevant. Okay, so that will be really, that will make your work a little bit easy. Then remain calm. Try to, I know there will be only 15 minutes, but don't put a lot of hurry, because sometimes you will miss out some of the words, and those words will be the building blocks of your answer. So that cannot be done. Okay, because it will just change the meaning of the word, and it will change your answers. Once you understand the meaning of the sentence, okay, understand that what type of words can fill in the gap. Okay, read the sentence in the head first. Okay, and then understand that whether it is grammatically correct, whether it sounds right, and then just write it out. Then scan the text. Okay, understand all the relevant cues so that you can understand what facts are there in this passage. Then if you find numbers, words or number, these can also be the answers. Okay, so understand what the information might be in this particular gap. And the last thing, read out the sentence in your head if it is a grammatically correct or not. This will be really helpful for you to understand that whether you are going right or not. Coming to part B, there will be multiple choice questions again. Okay, so it will help you to understand how to have a clear understanding about all the three options, because there will be three options and they will be have been, it's really possible. It is certain thing that they will be writing all the three options in the paragraph. Okay, so make a mark or underline keywords. Okay, try to practice on the paper. Okay, printed paper. It will be really helpful. Okay, because once you underline or encircle any particular word, it you automatically give a more emphasis on that. Okay, next step is to read the text thoroughly. Okay, read it out, find out all the three options. Okay, understand that where you can find out the options. Okay, because it will help you to figure out your answer quickly. Okay, and time and energy will be saving you from the options. So it's better first of all mark the keywords and then find out the options in the text. Okay, uh always cross off the wrong answers. Okay, once you are moving along the text and you are getting all the options, and if you feel that this option is incorrect, just mark it wrong so that you can get your answer by elimination method. So that is how you can attempt your part B. Coming to part C, now let's just understand about part C. It will be a long text, I know. Okay, questions, but one positive thing is that question will be arranged in sequence. Okay, uh, the way the questions are arranged in question booklet, same will be arranged in the text booklet. Okay. So in section C of the reading exam, the questions are arranged in sequence, remember. So read the title of the text and skim it in 2 to 3 minutes. Okay, skim it out. Okay. So you can read the first sentence of every paragraph. Okay. So that you can understand the general idea of the statement. Okay. General idea of the content. Okay. And the next thing, whenever you read the question, make sure you read the question answer options as well. Okay, this will help you to understand that what can be the correct answer. Okay, then again an important thing, try to compare the given options. Okay, compare all the 4 options and understand that which of them perfectly matches your given question. Okay, let's just assume. And yeah, one thing more, that there will be alternative expressions. Okay, for instance, wonderful in the question can be extremely good in the passage. Okay, so synonyms will be there, but again, you have to divide them. You have to understand all the options. Okay, and compare them, and you will get your answer. So that only thing you have to do in reading part C. So I guess I was clear for listening and reading, right? So coming to writing, the third module, the first profession specific module. The questions will be different for each profession. Okay, these will be prepared in such a way that you have to focus on all of them one by one. So there will be one task set for each profession. Okay, based on your workplace situation. Okay, the basic thing is to write a letter. Okay, usually a referral letter. Some alternative types of like letter of transfer, letter of discharge. Okay, that just change. That just keep on changing. Okay, sometimes but you have to write a letter to another. It can be to your same profession. It can be from another profession. Okay, so it will be a task variation. Okay, so you have to practice different task variations. Okay, then you will be getting case notes. What you have to do is and go through those case notes, understand all the content, and then write a letter to the concerned person. Okay, that is the basic thing you have to write. You will be getting 5 minutes for reading for to understand all the case notes, and in 40 minutes you have to write a full letter. Coming to The assessment, how you will be assessed, because in listening and reading you had 42 questions. If you're getting 30 out of 42, that means you will get your B. But here how? There are 6 different criteria, okay, on the basis of which you will be assessed. You will be given marks in all these 6 criteria, and in the end, uh, the total of them will be helpful in finding your correct numerical score, which will in turn help you to understand the correct grade. Okay. First of all, purpose. A purpose of the letter should be immediately apparent. Okay. Reader should, immediately understand that whether the what this letter is all about. Okay. For example, we will be writing a letter in a hospital. Nobody is having that much time to, read each and every sentence and then understand. It should be immediately apparent to the reader that about whom this letter is, what diagnosis is, and what I have to do for this. Okay, so it should be immediately apparent. Second, content. We cannot include all the case notes. Okay, we cannot. Right. Only those things you have to write which are necessary for the next patient, next person. For the psychiatrist, there is no need to write painkillers and antibiotics. Right. For psychiatrists, you need to write the antidepressants. So these things depends on the content. Then consciousness and clarity, unnecessary information should be omitted. Okay, you are not required to write any unnecessary information, any irrelevant content there. Okay. Then genre style, your tone, use of abbreviations is acceptable, but only those abbreviations should be used which are universally acceptable. Organization and layout, whether the letter is organized, okay, and it is well laid out for the reader, okay, it is organized or not, okay. The information should be written in that particular way so that it should be organized in a particular format. Then language, okay, whether the accuracy of grammar, vocabulary, or spelling and punctuation, it is there or not. Okay, so language is also an important aspect in this particular scenario. So that is how we have to, your writing will be assessed. Now, how to attain these 6 different criteria? Let's just assume that your task is, regarding a particular things. Okay, so you have to find out the most relevant task notes. Okay, those first 5 minutes of reading time will be helpful in that. Okay, so that you can understand that these are the case notes that you have to focus. These are the case notes which you have to, write down. These are the case notes which you have to omit. All these things you will be having 5 minutes for that. Then choose the right OET writing case notes. Okay, just choose those case notes which are important. Okay, study them properly, identify which points are relevant and which are not. Okay, and only use those. Let's assume that if you are writing a doctor about patient's vision issue, okay, obviously, if I'm writing to an ophthalmologist for the vision issue, we are not required to write that they broke their leg 15 years ago. That will not be acceptable here, right? It will be irrelevant. So it will just be a negative marking for you. Okay, so remember this one. Then organize the case notes. How to organize? First of all, there should be introductory statement, then main issue that needs to be covered, then secondary issues, then other minor details, and in the end, your request portion. Okay, now how we can use these things? Let's just have a dwell deeper into detail. First of all, introductory statement. In this, you have to write about name of the patient, then diagnosis. Okay, then some of the things. For example, if you are writing about a recurring vision problem, you can write like, I am referring John back into your cure for the full assessment of his recurring vision problems. So that means just by reading out the introductory sentence, the doctor will understand that, okay, I'm getting, this is the patient and this is the problem he is having. Okay, then come for the main medical issue. Okay, you have to specify that what is the main medical issue John is facing. Okay, scan through the case notes and understand that these are the information which you have to highlight. Then secondary issue, if there is any secondary issue, just mention in the next paragraph. Okay, like if their social history is impacting their current medical situation, just. And yeah, one thing more, this point is very important, guys. Mixing. Never mix the ideas. If you are mixing the ideas, it is making the reader so confused. Okay. And other details, just and mention the minor details if they are worth mentioning. In the end, request what you want the next person to do. What is your requirement? Mention about that. So this is the basic format of writing a letter. Okay. So always keep these things in your mind while attempting a letter. You will be easily getting a good score in this. I guess I'm clear with the writing part. Uh, Last thing that I need to mention that never use the case notes, guys. Okay, transform your letter. This is an English language test. They are trying to understand how you can transform the case notes into your uh, normal linguistic skills. Okay, don't copy the case notes. Okay, don't just copy paste there. Okay, it will be of no use. It will be negative thing. You have to present a story. Okay, so analyze the case notes, rework on them, and make sense to the reader. 40 minutes are enough time for 180 to 200 words. Okay. So how to develop these things? Just practice. Okay, just practice with the tips that I just told you. Okay, practice them again. You will be read some of the writing sample letters. Okay, browse through the OET writing sample sheets. Okay, it will really help you to get a hold on the writing. Okay, so I guess I am very clear about writing. Coming to the speaking. Now, speaking is the one of the thing, guys, which is one of the most practical situations in OET exam, because these are the visits. It will be a consultation visit between patient and healthcare professional. Simple. The thing will be that interlocutor will be there, who will be sitting in front of you. He will be having some of the question bullet points. You will be having some of the bullet points in front of you. You guys just have to have a two-way communication about a certain thing. You will be acting as your professional. For example, you are a nurse, you will be acting as a nurse. Okay. So he will be asking you the questions and you have to answer them. And sometimes you will be asking the question, he will be answering. But the difference is you have to speak more because it is your test here. Okay. So there will be two role plays in which the next person will be patient or patient's relative or patient's carer. Okay, there will be different situations on the card which you will be provided, and you will be given 3 minutes of preparation, and then for the 5 minutes the role play will go on. These will be based on a typical workplace situation. All the common topics will be there, like headache, asthma, diabetes, dialysis. Okay, so the really common things will be there which you can easily go. If there is any specific thing, specific knowledge that you have to share, they will be mentioning on the role play itself. Okay, so it will be easy for you to cover up the topic. So interlocutor will be having detailed information that what information you need to use in each role play. Okay, so that is the format. Now again, speaking is assessed on the basis of two different criteria: linguistic criteria and clinical communication criteria. Now, what is linguistic criteria? Linguistic criteria is divided into four parts: intelligibility, fluency, appropriateness of language, resources of grammar, and expression. So these are the four different criteria on the basis of which your language skills are assessed. How well you can speak English. Okay, intelligibility assesses your impact of your pronunciation, your accent, how listener can easily understand. Okay, there should not be a strain in the listener that he's trying a lot to understand whatever you are saying. Okay, so that is known as intelligibility. Fluency, what is your flow? Smoothness, how much smoothness is there in your speech? Okay, there should not be hesitation pauses. There should not be thinking process. So that is known as fluency. Appropriateness of language, impact of your language on tone and professionalism, and that impact your listeners' understanding. Now, the basic example of appropriateness of language is the hypertension. For the patient, it's blood pressure. For any layman, who is not from the medical background, it is blood pressure. But for you, it is hypertension. So if we are using the clinical terms, there should be a proper explanation of the content to the patient so that we can easily understand. Resources of grammar and expression, your grammatical accuracy. Okay, your grammatical accuracy, your vocabulary choices, all these things fall under the category of resources of grammar and expression. So these were your linguistic criteria. Coming to your clinical communication criteria, there are 5 different criteria: relationship building, understanding and incorporating patient's perspective, providing structure, information gathering, and information giving. So clinical communication criteria, these are the criteria which directly impact how you can be understood by the next person. Okay, if you are, how you can, relationship building means how you can build your relationship, demonstrate an empathy and respect for your listeners' comfort. Okay, how you can do that. Okay, then under how you can understand and incorporate patient's perspective. Okay, how fully you will involve the patient in the conversation and understanding your comfort. Okay, how, then providing structure, whatever the things are there, whatever things are presented in front of you, the bullet points. Okay, how you are presenting it to the patient. Information gathering. Now, speaking is not only the speaking skills, it's also about listening skills also. How you are understanding the patient's questions. Okay, how you are understanding all the points that the interlocutor or patient is saying you. That is the thing which falls under the category of information gathering. And the last, information giving, how well you are understanding your comfort and understand. Okay, how you are presenting the information to the patient. Okay, so these all becomes a clinical communication criteria. That means how well you can build that particular trust so that patient can share all the information. So these are 9 different criteria on the basis of which your speaking will be assessed. Now, how to carry out the speaking so that you can get a good score. Now, one thing is important. First of all, play your role. But whenever you are sitting in front of the interlocutor, act as a health professional. Don't act as a candidate who is very nervous that my exam is going on. It will not a positive thing, guys. Okay, act as a professional, whatever you are. You are nurse, act as a nurse. You are a doctor, act as a doctor. Okay, you are dentist, physiotherapist, whatever health profession you are, just be yourself. Okay, it will help you help you attaining a sense of realism. Okay, and it will be very helpful. Then breaking the ice. Most important thing that that you should have in mind, that you have to start the conversation first. Okay, whenever patient visits you, it's not patient who start the conversation, right? It's always you, that you ask that what the problem is, you understand what his issues are. Okay, so just keep this thing in mind that you are on a professional setting, so that the way you deal with your patient, it's the same thing you have to do. Okay, 2 out of 10 patients or clients start the conversation. Okay, so you have to start it on. Third thing, keep the conversation going on. Okay, there should not be a pause. Whenever there is a silence, just it's your responsibility to start it again. Okay, for example, can you tell me more about the situation, or is there anything you would like to add? Okay, so whenever there is a silence, just take a step and solve it. Okay, keep the conversation going on. That will be very helpful. uh, the last 3 things: understand patient. As I told you that speaking is also a test of your listening skills, because you have to mold yourself according to the things which patient are telling, because you won't be having access to the bullet points that are presented to the patient. So always have a little bit of understanding upon that. Then upgrade your language. Okay, never fast. Okay, don't talk fast. Okay, nobody will understand. So you have to mold yourself. If you are dealing with a depressed empty or time, okay, you know how should proceed. And on the other side, if you are giving a reply to aggressive 19-year-old boy, you should know how. Okay, so you should mold yourself. Okay, you should handle at yourself. Okay, it will be really easy if you are taking it as a real life situation. Okay, it will be really a beneficial thing. the last thing, be ready for unexpected turns. Okay, there will be some of the things which will not be mentioned at your role play, but suddenly the interlocutor can say because it was mentioned on his side. So be ready for that. Don't get nervous. Don't get confused at what to say now. Okay, never do that. Okay, be confident. It is just like your professional setting environment. If you are, mimicking that particular setting, you can easily be ready for unexpected turns and you can easily respond. Okay, so that is how you have to go for your speaking. So that is how we have to do our speaking test. So I guess I was really beneficial in this one. So that is how we have to go for. Now I guess I have been really clear with all the four modules. I guess it will be really uh, a helpful session for all of you. Okay, so these are the things which you have to keep in mind while attempting the OAT. And if you are abiding by these, you can easily get your minimum required score. Okay. In the end, I will just ask you, never give up. Nothing is impossible in this world. Okay, you guys can crack it. Believe in yourself. Just practice it hard, and you can easily get your desired score. Okay. So that will be all. I guess that was a good session. Okay, so all the best for you guys. Thank you so much for attending this session. Bye. Have a nice